We're ready for our discussion.
All right, Jan.
Uh, he, Dr. Hora,
Yes,
my name is Gene. My,
Gene.
yeah.
Could you talk a little closer to the microphone, Gene?
Okay, how's the?
That's fine.
I have a problem that I think it manifests itself in a number of different ways. And it started in October of last year when I was involved in an automobile accident.
Yes,
And my best friend was killed in that accident after we had been drinking.
yes,
And I have since then a problem with my ankle. My talus with their knee, and they're attempting to fuse the tibius to the heel bone.
yes,
And it is not working. I walk with some pain, and if it is hit, there's quite a sharp pain.
yes.
Now, also along with that, I have been convicted of felony vehicular manslaughter, and I'm due to be sentenced at the end of the month.
In connection with that accident,
Yeah,
you were driving.
yes, I was.
I see.
They determined it was my fault, at least the courts have.
Yes,
And I would like to understand the meaning of the physical symptoms
yes.
and the ongoing involvement with the court system.
Uh-huh. You are on the charge of driving under the influence of alcohol, is that it?
Well, they are going to drop that charge in exchange for a plea of guilty which I have entered to vehicular manslaughter.
A plea guilty?
A plea?
A plea of guilty?
Yeah.
I see. So they are blaming your friend's death on you, on your negligence, or what?
Yeah, the actual charge is felony vehicular manslaughter with gross negligence.
Gross negligence.
Where I was convicted of running 2 red lights prior to the accident.
Uh-huh. And you were drunk then?
Yes, my alcohol content was determined to be 0.12, where 0.10 is legally drunk in California.
I see. Uh-huh. And what happened about a year ago?
Not quite, with
Okay.
October 20th, 1980.
Well, yes. Now, what did your question be?
Well, I would like to know the meaning of the problem I'm having with my foot, with the difficulty in walking,
Yes,
the problem with the healing, and,
yes,
and it doesn't seem to be being profitable.
yes. That is your main complaint then today, right? That's what you would like to have healed primarily.
Primarily, yes. There are a number of other things associated with that, I think, but that is my main complaint.
What are the other things associated with?
Well, the problem with the court, I'm not looking forward to being sentenced to doing some time, which is a possibility, serving time either weekends or during the day and allowed to go to work. And also, I have my friend's dog who had an allergic reaction to flea bite.
Yes,
I'm not allowed to have dogs in my apartment,
yes,
and I care for this dog, but I don't really want it.
yes,
And if I leave him home, he messes in the apartment.
yes.
And if I take him to work, he ends up getting attacked by fleas.
Uh-huh.
And I'm really kind of perplexed about what to do about the dog also.
Yes.
And
What is the nature of your work?
I work at a sand and gravel plant.
Uh-huh. Uh-huh. At the laborer?
Well, I am the morning supervisor at this particular plant.
Yes. Well, have you stopped drinking tea? Or are you still drinking?
I have stopped for Tuesday. It will be 3 weeks.
Uh-huh. Are you enrolled in the AA program?
I'm not. That hasn't been suggested to me, but I've been seeing Fern Rubin here and attending a group session with Jan once a week, I guess 3 times now.
Yes, just 3 times. So you don't know much about metapsychiatry then? Yes.
Well, I'm just beginning.
Yes.
But I did attend your conference at Irvine.
You did, yes.
And the following weekend at the Marriott Hotel.
Uh-huh.
And I'm familiar with your book.
Uh-huh.
But I still feel as I am a beginner involved in the whole thing.
Yes. Well, then we have to ask the question, what is the meaning of the persistence of the physical problem? Right?
Right, that's my first question.
That is your first question. Well, as you know, the physical is mental.
Yeah.
So apparently it is the memory of this experience which is hurting you.
It seems to be that way. I still carry some blame for it.
Yes. A sense of culpability.
Yes, that's a good word.
That now you have to seek to find a way of forgiving yourself. Who do you think is really to blame for this experience?
Well, I have been told that ignorance is blame for the experience.
That's right. Are you willing to see it that way, or would you rather take the blame yourself?
Well, that's a good question. I would like to be able to free myself of blame.
To free yourself of the blame. Yes. But isn't it embarrassing to be ignorant?
For me, quite embarrassing.
Uh-huh. So I would suggest that you have to be willing to be embarrassed about your ignorance. And then you will be able to forgive yourself, and then your foot will heal. As long as there is a sense of personal culpability, the foot cannot heal because it's a sort of bragging. It says, I am responsible, I am to blame, I did it, I'm a bad guy, and I should have known better, etc. But if you're willing to see that you are a victim of ignorance, then you'll be able to forgive yourself, find your peace, and then a physical healing can take place. And of course, that is also very important for the outcome of the court action. Because as long as you insist on being personally blameworthy, you're going to be punished by the court. But once you have understood that it is ignorance that is the blameworthy party in this situation, then chances are you will be forgiven, even by the court. It is a primary issue right now to find a sense of release of culpability. You see, to say I am guilty is a self-confirmatory thought. Have you ever heard that phrase, self-confirmatory?
Oh, yeah.
Yes.
I say it to myself a number of times each day.
Okay. Is Fern there today?
Yeah.
Yes, all right. Fern, do you have something to say?
Well, I was listening very carefully, and one of the things you said was willing to be there by ignorance,
Yes,
then we give ourselves for blame.
right.
And if you're saying, I think that means then that it's easier for us to blame than
Yes, that's right. Didn't you know this?
it just occurred to me when you were saying it.
Yes, we would much rather blame ourselves than admit to ignorance. That's part of our vanity.
Sure.
Then you have to be very humble to admit to ignorance, especially mentally humble. Not many people are willing to admit to ignorance. People prefer to consider themselves blameworthy and suffer the consequences. Certainly, if Gene were blameworthy, he couldn't be healed. He would have to suffer the rest of his life the scars of that experience. But if he admits to ignorance, then he is absolved, and a healing can take place, both in his foot and in his soul, his psyche, and find peace and redemption.
Thank you, Dr. Hora.
Another thought has just come. It is the vicious cycle of alcoholism. The alcoholic is a very vain individual, and he has a tendency to blame himself for everything. And when he blames himself, he feels so guilt-ridden, he has to reach for a drink in order to release his guilt. And then he thinks again, and then he feels guilty for drinking. And then he has to assuage his guilt feeling by another drink. And that's a vicious circle. But if you can get an alcoholic to understand ignorance, then he may not have to drink anymore.
Professor, could you help me see the difference between blaming yourself or saying you are ignorant? Would that be, how is the difference?
Well, we didn't say that you should say that I am ignorant. We say one has to understand that ignorance is the culpable party in our mistaken ways of behaving. See, we have to, it's not enough just to say. Like for instance, in Alcoholics Anonymous, the people are required to make a humiliating statement publicly and proclaim themselves to be alcoholics.
Yes.
I am an alcoholic. They all keep saying that.
Yes.
Now, of course, it is like saying I have a sickness which makes it impossible for me to hold my liquor. You see, well, that's not the same. If someone would say, I realize now that I am very ignorant and I have suffered the consequences of my ignorance. Ignorance is not a sickness, it is a disaster.
But isn't admitting ignorance the beginning of wisdom?
Right, that's right. Who said that? Roberta, nice to hear your voice, Roberta.
So, ignorance, when we understand ourselves to be ignorant,
Yes.
we shift to an epistemological issue.
That's correct, Jan. That's a very good point. Right, it's an epistemological tour de force.
And otherwise, we are actually operational.
Yes,
So we
that's
blame
right.
ourselves. I did it.
Yes,
I didn't do anything.
that's right.
I'm just
A victim of ignorance.
a victim of ignorance. Yes.
Right,
I'm not even ignorant, and there are ignorant thoughts of tainted consciousness.
that's correct.
Not correct that I'm ignorant because I'm not. I'm God's image and likeness.
Yes. Who is temporarily in a state of ignorance.
Dr. Hora,
Yes, sir.
when we attempt to cope with some problem in our life,
Yes.
is this also a vanity of not wanting to see that it is present?
That's right. It's a tremendous there is a universal resistance to admitting to ignorance.
So the idea that when we suffer from, we have some crystal power to make things better or change things
Yes,
is a lack of humility and unwillingness to look at the ignorance that we become a victim of.
right, right. Everybody would like to believe that he is smart, you know. It's a universal desire to believe that we are smart and we know everything. And once you have this desire, then of course you will not, you will be loath to admit that you're ignorant.
Dr. Vora,
Yes,
it was first suggested to me that the cause of the accident was ignorance in December of 1980. And I have been telling myself that for the last few months, but obviously I don't truly understand that, or I still suffer the physical symptoms.
the accident didn't have a cause. The ignorance didn't cause the accident. The accident revealed the presence of ignorance. There is no such thing as cause. Does everybody understand the difference between a meaning and a cause? You are strangely silent over there.
We're contemplating your wisdom.
Well, would you clarify that for me?
Let somebody else do it.
Okay.
How about her?
Well, it mainly to feel that ignorance has been present the day before the accident and the week before, and that it's been revealed in many, many ways.
Yes.
And we don't want to wake up until something happens when we cannot avoid looking at it anymore.
Right, exactly.
Whereas if it was a cause, it was just there in that day.
That's very good. Right. Does everyone understand it?
Right.
A meaning is a mental equivalence of a phenomenon. The accident reveals a certain condition of the mind which was in a state of ignorance, aggravated by alcohol. And that is the meaning of the accident. And the purpose of the accident is to bring this to Gene's attention, being forced to face the fact that everything in life depends on the state of our consciousness. And we are stewards of consciousness. And we must maintain our consciousness in an alert and humble and loving condition at all times. And that is the only safety there is in the whole world. Whether we're driving or just sitting in a room.
Do I need to understand the particular form the ignorance is taking in my consciousness? Like you say, ignorance manifested itself in the accident.
Yes.
But do I need to understand the particular form of ignorance? Or is it sufficient just to understand that it was ignorant?
Well, your particular ignorance has a quality of recklessness. Is that true?
Yeah.
So recklessness is a very dangerous form of ignorance. So here is a situation where life requires you to learn to abandon recklessness and drinking liquor and all the other forms of ignorance and devote your attention to the intelligent, to the principles of intelligent living. You know, we have 11 principles of intelligent living. You're familiar with them?
They're listed in the back of the dialogues.
That's correct, right. Every day we study and meditate these principles. And they in turn protect us from all sorts of unpleasant experiences and make life harmonious and intelligent.
Dr. Hora,
Yes?
when you say
Who is speaking, please? Burn, yes.
when you say meditating on the intelligent principles,
Yes.
and they protect us,
Yes.
can you clarify how it is that they protect us by dedicating on it?
Well, if we appreciate these principles, they alter our ways of thinking about every aspect of daily life. We see things intelligently, and our priorities are rearranged. You see? For instance, a reckless individual, a reckless form of ignorance, that has a priority of thrill. So to some people, having thrills and excitement is the first priority of life. And that's a dangerous form of ignorance. Now, our first principle says, thou shalt have no other interest before the good of God, which is spiritual. So our priority is spiritual blessedness, harmony, peace, assurance, gratitude, love, right?
Right.
So right there we have the first principle. We will establish an intelligent priority for life, and will immediately heal us of the ignorant idea that life must be full of thrills and exciting experiences, which so many people believe and pursue.
Thank you. That helps.
You're welcome, sir.
Get heat. Dr. Hora,
Yes,
my name is Ilona.
Ilona.
Right. And I am a married to family counselor,
Yes.
and I am having difficulty with a client that I would like clarification on.
All right, Ilona.
I feel like the thing you just said to Jean, I should have be able to apply them, but I'm not yet able to, so I'll answer.
We don't shoot, Ilona.
Thank you. Okay, the client is a 24-year-old male who is marginally functional in society, quote unquote. He maintains a job. He is quite paranoid, although he has not generally been real crazy, with hallucinations and whatnot. We had a off and on experiences with drugs and alcohol. He recently had an experience with drugs, cocaine, and they suspect that PCP was mixed with it. He had an acute psychotic reaction to which his parents hospitalized him. He does not live with his folks, but he went to them and they hospitalized him. And he was there in the hospital for about a week to 10 days. He was receiving a very low dosage of medication. He was released and is now staying with his parents. And he seems to be, he was not on meds. He has since started meds again, but he is not responding really. He's kind of giving up. He made a suicidal gesture that his mother perceived as just a gesture, and it irritates her. He is he won't eat, and he is just very flat affect. He has kind of given up everything to his mother in the sense that he no longer calls to converse or to come to appointments. He just sits back, and his mother is frantic, and she is the one who does all the calling and talks for him. So I've talked extensively with her. She's very fearful that he, will become a vegetable and, just not be productive and whatnot. And I'm not really sure what my question is. Obviously the client is not coming right now, and so I'm dealing mostly with his mother, and I guess I need some clarification on what's going on or how to help her be beneficial or something. Can you help?
Well, if the mother is receptive to metapsychiatric principles,
the things that I have shared with her, she kind of understands. It feels like she needs to do something.
to do something.
Yeah.
Like what?
Well, to try to encourage him to go for a walk, encourage him to eat well, encourage him to get out, garden, or encourage him to, keep busy so he just doesn't sit by himself and think of crazy thoughts. Crazy thoughts like that he is to blame for some of the tragic current events going on, that he had ideas that they would happen, and now that they've happened.
You mean political events or what?
Oh, like when the Pope got shot, or he had a friend who was killed in a car accident.
He takes credit for that.
Yeah, he's taking credit for a lot of that.
Yes.
Yes.
Well, then you have here a case. You see, the trouble with using traditional psychiatric jargon to describe somebody is that you wind up not understanding the meaning of his mode of being in the world.
Right.
And that's a handicap. You have to learn to forget about this clinical terminology like paranoia, schizophrenia, and all the things you said about this boy. And then you just simply realize that here is a youngster whose self-confirmatory ideation has gone haywire. all out of proportion. So, to the point that it is could be considered, let's say, insane. Right?
Right.
So then the problem is how to heal the self-confirmatory ideation.
Right.
Especially if the patient isn't even coming to see you.
Right, that's a good point. We have dealt with that, and he has, I guess, similarly to Gene's experience, felt that he's blaming himself for his ignorance.
Who?
My client.
The client is blaming himself for his ignorance?
Right.
Well, don't you believe it?
I don't.
He's taking credit for it.
Right.
Now, you have to find out.
Like, that's one way, I realized that he was touchy. And then also, like, if you were to bump him accidentally, just maybe brush by his arm, he would go, ouch, or like an exaggerated reaction. There's absolutely no way it could hurt the touch that you would give him. And so I thought, now, what is the meaning of him being touchy to people or being touched or close to people? And I wondered if you could answer that.
Well, it revealing certain characteristics of sensualism.
That's interesting. I told Danny this morning what I was going to ask you, and he said it sounds like sensualism. And I thought, no, that can't be it.
You mean you never heard of this before?
No, never.
I've heard of it before, but I didn't think of that in this instance. I did think of the word irritability, though. He seemed irritable, and I know that you pointed out to me irritability is sensualism.
Right.
So is his touchiness a product of the whole family environment, or is it the person's thoughts at the time they're close to him, or is it his parents' ideas?
If we say, don't touch me, or if we say, touch me, that's the same. Do you understand it?
Yeah.
So, it's sensualism, and of course the whole family can be healed of sensualism by increasing the appreciation of spiritual good.
One reason why I was wondering if that with sensualism is in our family, a lot of areas that I recognized sensualism to be affecting were being healed, and this area doesn't seem to be changing. So I had thought if it was sensualism that he would be less touchy now than before.
He will keep pace with the family.
Okay, thank you.
You're welcome.
What? Sorry.
Hello, Dr. It's Roberta.
Yes, Roberta.
David Benny brought up her son. I'd like to bring up some about mine at the time, Roger.
Of course.
And he's 14 years old, and it's going to be a long summer. And I work full time, and we talked about how he could occupy his time, and he doesn't want to go to a camp, and he feels he's too young to work. So we suggested that he can go to school, and he's going to school for 6 weeks. But I think we've got a 13-week vacation, and he tends, I think of him as a very intelligent and creative and imaginative, well, I shouldn't say imaginative here, excuse me. Creative boy. But he tends in the summer, last summer, previous times on vacation, to be very idle. Idle meaning watching a lot of television, just sort of sitting around.
Television is very imaginative.
Well, as a working parent, I'm concerned that the summer will be a time for him
to use his imagination.
Yes. And not be, it appears as if he spent his time in unproductive way.
Yes.
I come home now from work, for example, and he's often be sitting there in front of the television.
Yes.
And today after I come back, I'm going to take him someplace. I actually like to go, I mentioned it to you, like he suggested my we thought we were going to do that, but I can't entertain him. And I would like to understand that he doesn't seem to be productive. At least I see it that way. And I need some help with it.
Well, find him a girlfriend.
Imagine it if mine.
You should see Roberta's face.
Unheard of idea.
I'm shocked.
I'm not shocked. He's like, he doesn't appear to be interested in girls, that I'm sure he can, but he doesn't seem to have any girls in his life. So I don't know, but that's you really got the girl. How do you get him a girl?
I can't tell when you're kidding and when you're really telling us things about your Hora.
I'd like to understand, but
You would like to understand what?
well, my concern with the thought that he is not productive and that he will be idle for a good part of the summer.
Well, I don't think that's the problem, Roberta. It's just possibly that you are afraid, really, that you will find a girlfriend.
I never even thought of a girl. It never even dawned on me about a girl.
Does he play tennis?
No, he's not athletic in any way, which is unusual for our family. He likes science, and he likes to do experiments, and he likes to draw pictures.
Yes.
And he's very mechanical. And
I am sure he will come up with something. You don't have to worry. You don't have to do his thinking. Perhaps you are over-concerned.
yes, I am.
The divine mind can provide him with the right idea. And you pray for him instead of manage him.
Thank you. The man is good. Dr. Glass,
Yes?
this is Alona.
Ilona, yes.
I have another question about my client.
All right.
I wonder if you could clarify for me, if necessary or important, for me to understand the meaning of Greg, that's my client's name, his just kind of giving up, in the sense that he does not make his own phone calls or cancel his own appointments or make his own appointments or doesn't really do those things now without his mother prompting those responses again. Where before this all occurred or happened, he was living independently, had a very good budget, managed his money well, had a job, all these kinds of things, lived independently. And now he's just not really doing anything. I think that really a fear of his mother's in terms of, what's happening to him.
Well, it looks like this is the mother's problem. It is possible that it's an overprotective mother who has paralyzed his initiative. There are such mothers, and then the boy looks like he is the patient, but actually the mother is the patient. So you're working with the mother, and that's the best approach.
Okay, that's all good. Thank you.
You're welcome. Some mothers are not really mothers, they are managers. And if they happen to be psychotherapists at the same time or amateur psychologists, well, that is a very disastrous situation. A mother is a mother. The essence of a mother is love. But managerial functions are no part of motherhood. And very often people mistake that the process of being a mother or being a therapist or a manager. A therapist mother will drive the children into schizophrenia. And a manager mother will immobilize the children.
Well, what about, and I guess this is an operational question. There's some concern on the parent's part that they are not willing to let Greg go back to his own apartment because they're afraid that he will not be able to really take care of himself. When he has all the skills, he shows, all in his life that he passed them.
Yes.
What kind of, I don't know, reassurance or what approach would be helpful in helping the parent see whether or not he should go back to his own place?
This is an irrelevant issue. The issue is to heal the consciousness of the mother or whoever is the dominant parent in that situation, and helping them to understand love as letting be rather than managing.
That I kind of suggested some things like, in that respect to her, and she seems to be receptive to it, but I guess when it comes down to brass tacks, it's really hard to follow through with when you're seeing your child not responding. Thank you. That's helpful.
Dr. Hora,
Yes,
this is Betty again.
yes, Letty.
When you brought up the subject of being a managerial mother,
Yes,
I think I tend in that direction with my two children. And this summer, I started working a part-time job, and I have some of the same questions like Roberta. I wonder about their time when they're alone.
yes,
And so I decided to kind of structure the things that they were allowed to do while I was gone. And before I started work, I sat down and wrote up a list of rules and guidelines of what they could or couldn't do while I was gone to work. And I had the idea that it was important to give them some structure, being that they're 12 and 13. But I wonder, am I fooling myself and I'm just trying to manage them, or is there really sometimes a need for that?
the need is always for values, and values are communicated existentially. This kind of managerial arrangements, they will never work because they are experienced as impositions, and they are laws to be circumvented rather than accepted. So the best way to be a parent is to be a model of right values. And it is the values then which keep the children in line.
I mean,
The parenting is not an operational process. It is an existential process. And the basis of parenting is communicating values in a meaningful way.
Could you say then that there would never, if you were parenting from the level of values, that there would never be a need to set down guidelines?
Most probably not.
Okay. Thank you.
You're welcome.
They did it. They still it. They will
Let it do. Didn't say nothing.
That's right.
Dr. Hora?
Yes,
Hi, this is Linda.
Linda. Yes.
I haven't quite formulated this question yet, so I'm gonna.
I'll wait.
It has to do with boyfriend.
Yes.
Yeah, so it's a hot issue.
You must have hot boyfriend.
I was at the last seminar, and we talked about the prayer of right thing, the meditation on right thing,
Yes.
and I decided that it would be a good idea to do that about my boyfriend, and stop looking at him as a boyfriend and that sort of thing, and just see him as an individual who is here for God.
Yes, very good.
Yeah. Well, 2 weeks later we broke up.
You see, Linda, it worked.
Let's see, where was I? Well, now, and then it just so happens that immediately thereafter, another gentleman presented himself to me,
Uh-huh.
who had been presenting himself to me for some time, but I had been shooing away because I had a boyfriend.
Uh-huh.
And he's a very, very nice person. He's much more gentle. He's much nicer. He's very bright. Every bit as bright. But I'm having a lot of trouble in a transition. I not being able to. Didn't seem like I had time to let go of one before I moved into the next. But then I feel like if I did have the time, I wouldn't be letting go anyway. I'd just be mourning or moping or something. So, anyway, I feel as though I feel attached or hooked, like I'm not being able to move on really in a smooth manner, and somehow I feel like I'm being tugged. And my prayer and what I've been working on is that you don't ever need to know what's going to happen or attach to what has happened. You only need to appreciate that the good is always unfolding, no matter what is going on in your life.
That's right, Linda. Actually, what you describe is a beautiful demonstration how God sets you free of a wrong kind of involvement and immediately replace it with a better one. You see, on the spiritual path, we are always moving from good to better. Although that prayer is very effective, Linda. And yes, it's good, but no, it's also good. This is also a demonstration of that.
Because no can also be good.
That's right. Under divine guidance, no is also good.
Or
You just stay with it, Linda,
okay, I guess it's just very.
and let God be your matchmaker.
God's a yenta. Okay. Just a little side note here. When my new boyfriend, when he presented himself to me, felt like I was really relying on God in that. The whole thing seemed that it was forcibly going to be short-lived, because in 5 weeks he is supposed to go away to Nashville, Tennessee, to medical school.
Yes.
To Vanderbilt University there, and just about 3 or 4 days ago, at the last minute, he got an acceptance to UCI.
Yes.
So, So now he doesn't know whether to go to Vanderbilt or not, and I'm saying God is in control. God is in control. So anyway, well, thank you, Dr. Hora, for the reassurance.
From Lisa.
So it is, Wednesday. Yeah, I don't think.
This is Roberta.
Yes, Robert.
I had a thought that once we are students of metapsychiatry and become sincere seekers,
Yes,
that we have a mission.
yes.
Is this so? And if it is, what is it?
Everybody has a mission in life. We were all created for the same purpose, to manifest love intelligence in the world. Because love intelligence is the main quality of God. And we are here for God. That is our common purpose. What is the purpose of a light bulb?
Shed light.
To glow, right? And to shed light. And what is the purpose of Roberta Carasso?
I'd like to know that.
To glow for God.
Great lower sticker. Oh, for God.
You could make a new bumper sticker with that.
Oh. Fuck if you go over. No, I don't.
You're welcome.
Don't do that again.
One more minute.
Oh, yeah. Dr. Hora, it's a lot out there.
It's Bulgarian.
Dr. Hora, my question is, when you had said that the mother might be the problem and that, anyway, what you said about that had occurred to me when I was dealing with her, and the question comes to my mind, oftentimes I don't really trust the impressions that I get, or the inspirations, or whatever they are, and so sometimes I'm a little bit timid, or I don't follow up on that. Can you explain the meaning of that?
Of what?
Not trusting, or well, if I get what seems to be an inspiration, not really trusting whether it is one or not, even though it seems to be.
Yes.
And being
Well, Ilona, I think that you have been very much influenced by traditional psychological training. You seem to be a well-trained psychologist.
She just completed her degree.
Well, that's a great handicap.
That's not true.
You will have to get beyond it. And then you will look not for clinical pictures, but you will try to understand modes of being in the world and primary values which determine people's thinking. And then you will be able to understand more. Don't be confused by psychology.
I'll try.
All right.
All right. Thank you, Dr. Hora.
You're welcome, Jan.
All right.
Bye, everybody.
Bye.